Hello and welcome to Health Affairs This Week. I'm your host, Jeff Byers. Today we have on the pod Rebecca Pifer, senior reporter from Healthcare Dive, a publication covering the business of healthcare, to discuss the non-compete ban and its implications on healthcare. Of note, Brent Fulton will publish an essay on the topic next week through our Health Affairs Insider program. The title of his essay is, Did the FTC's ban on non-compete agreements go too far? Also of note, we have a Journal Club virtual event next week on the article California's COVID-19 Vaccine Equity Policy, Cases, Hospitalizations, and Death Averted in Affected Communities with author Chris Hoover and Health Affairs' very own Leslie Erdelak. Subscribe to Insider to get those takes and get that insight. Rebecca, welcome to the program.
Thank you so much for having me. I'm excited to be here.
Yeah. So full disclosure, Rebecca and I used to work together for 2 months. Maybe was it 2 months?
Yeah, it was a short period of time, but it's nice. It's nice to be back with you.
Thank you. Yeah, same. Reunited and feels so good. Is that still a relevant phrase?
I would not know.
Same. All right. Well, someone let us know. Communications@healthfairs.org. So, Rebecca, give us an overview of what the non-compete ban does. What is it?
Yeah. So, thanks again for having me. So, basically, non-competes, for people who may not be familiar, they're just contractual provisions that prevent employees from competing with their former employer for a specific period of time after leaving their job. So the FTC proposed this rule banning non-competes early last year, and then went ahead and finalized it in April. So essentially what this rule does is that it bans companies from issuing any new non-competes for all workers by September 4th. And then at that date, the vast majority of existing non-competes will also become unenforceable. So employers don't have to officially rescind them or anything, but they can't enforce them at that time.
And so do you get a sense of what's the argument for non-competes versus what's arguments against them? Not to do the journalism both-siderism, but what can you tell us about that?
Yeah, so why the FTC wanted to ban them is basically there's a pretty large body of research that suggests that non-competes sort of make it harder for workers to move between jobs. They can suppress wages for workers. They can inhibit new businesses from being formed. They can raise prices for goods and services down the line. So the FTC is sort of saying here that their goal is to give people more freedom to choose where they work, and then give businesses more freedom to hire workers that match their needs. Non-competes are really not popular unless you're an employer. So the FTC, after they proposed the rule during the public comment period, they received 26,000 comments from the public. And according to the agency, 25,000 of those were in support of a complete ban. And interestingly, a number of those comments were from physicians and from other healthcare workers. So that's sort of the pro worker view here is getting rid of those.
Do you get the sense of the 1,000 or so comments that were pro non-compete bans? Did you get a sense of those were from lobbies?
Yeah, I can't speak to a specific number. I would say that the groups that support non-competes are employer groups. They're businesses groups, and those tend to be represented by lobbies and by associations. So a number of them did file complaints against the non-compete ban. And basically the argument there, it's two-sided, right? So there's the legal argument against the FTC doing this, which we can dive into more specifics, but essentially boils down to the FTC doesn't have authority to do this. And then there's also the operational argument against doing this in practice. So employers say this will make it a lot harder for them to attract and retain workers. This will translate to higher costs because they'll have to raise wages and expand their benefits. There's also the argument for non-competes that employers say that reasonable non-competes are really important for them to protect confidential information to recoup investments they might have made to hire workers and to train them. So employers and business groups are generally opposed to this, and that includes like hospitals. Hospitals are very opposed to this.
Yeah, that's a great segue. I do want to get into the potential lawsuits in a second, but you talked about how it relates to hospitals. One of the things when I was working at Healthcare Dive, I noticed that we got a lot of play on HR. Like when we used to not steal content from HR Dive, but when we used to borrow content from HR Dive, those performed pretty well because healthcare has a lot of employees. So it's interesting to think about that. So how might is there any other angle that from a healthcare perspective on this ban that you can think of?
Oh my gosh. Yeah. I mean, this is a short podcast. We could talk for an hour just about all the angles for healthcare. So the biggest one is for doctors. Doctors are the biggest group that this rule is going to affect. So hospitals really only use non-compete agreements for senior executives and then for physicians. They don't really use them for nurses and other medical staff. We don't really have a lot of data on the number of non-competes on non-physician staff, but hospitals anecdotally say it's not really common to use them for groups that aren't executives or doctors. So non-competes on doctors are fairly common. It's like about a third to 45% of doctors in the US are bound by a non-compete. Generally, what that would look like for a physician is under the terms of your employment, you're limited from going elsewhere to work that's within, like, say 10 miles of your current hospital for 2 years. So in regions with really high concentrations of employers, like large metropolitan areas, that radius encompasses a large amount of potential employers. So basically, currently, if physicians want to leave their job, it's pretty likely that they'd have to uproot their lives, uproot their families, and move to a different geographic market entirely because they couldn't work for a competitor in the same area and likely couldn't start their own practice in the same area.
So there already is a lawsuit. You alluded to this. The lawsuit's in Texas about the non-compete ban. Maybe there's others. What's all this about?
Yeah, so there's actually a number of lawsuits. Currently, there's at least 3 lawsuits that have been filed against this. So the one that you're referring to, and probably the largest one that people are tracking, was filed by the Chamber of Commerce and 3 other business groups. And they filed a lawsuit in Texas asking a judge to prevent the rule from taking effect. And they filed this the day after the FTC finalized the rule. So they were ready. They're alleging that the FTC overstepped its authority when it issued the rule and that the FTC doesn't provide enough proof that non-competes are anti-competitive. The FTC basically says that they're allowed to do this under like a plain text reading of the FTC Act. So one of the sections of the FTC Act says that unfair methods of competition are illegal, and the FTC is empowered to prevent the unfair methods of competition. So since the FTC has determined non-competes to be unfair methods of competition, the FTC can prevent them. So the FTC for a while has sort of gone after like particularly onerous non-competes on a case-by-case basis, and no one's really had an issue. The issue is now they're relying on that text to blanket ban all non-competes. That's one thing. Another thing is whether or not the FTC can do this through rulemaking. This is just a really substantive rule. The FTC says it's allowed to promulgate this sort of rule under the FTC Act, and then other legal experts really aren't so sure. It's something the FTC does really rarely. Courts have allowed it before, but it's thought to be a relatively shaky argument that they're leaning on this to do something so significant. And then the third thing is just that the rule could be viewed as retroactive. So generally, rules that alter the legal consequences of past actions aren't really allowed here. And the FTC is saying this doesn't do that. We're just prospectively stopping employers from enforcing non-competes, not penalizing employers for making the non-competes in the first place. And legal experts aren't, even ones that support a ban, aren't really sure about the efficacy of these arguments.
Do you have a sense of whether there's a ban for non-disclosure agreements for employers leaving?
That's a great question. So earlier when I mentioned that the ban bans like the vast majority of existing non-competes. There's exceptions. So the one you called out, NDAs are very much still allowed. Other terms of employment that workers might view as restrictive are still allowed. So, for example, an agreement that would keep someone employed for a certain period of time so that their employer could recoup like an investment made in their training, that's still allowed. So the ban only applies to true non-competes. So like to use an example, if a hospital were to require a doctor to work with them for 3 years or else repay all their earnings plus the hospital's attorney fees plus potential arbitration costs, that would be onerous and that would be illegal under this new rule. But a provision in a doctor's contract saying if you leave before 3 years, you have to repay a bonus, that's not a non-compete. That would still be allowed. So those type of contracts are still allowed. There are other exceptions too. So this rule, if it goes into effect on September 1st, the majority of existing non-competes are no longer allowed, but existing non-competes with senior executives will be enforceable. So the FTC defines that as people in policy-making positions who make more than $151,000 roughly a year. So those are still allowed for those workers. Then there's also specific types of businesses that this won't apply to. The FTC's jurisdiction doesn't extend to banks, to savings and loan institutions, to nonprofit organizations, which that has huge ramifications for the healthcare sector, right? Those types of organizations would still be allowed to use non-competes.
What are you hearing from your sources about this ban and how it might affect them? To your point, many systems are set up, many hospital systems are set up as nonprofits, or many hospitals are designated as nonprofit organizations. So how might this affect them going forward?
Yeah, so hospitals are super opposed to non-competes, mostly because they say that non-competes, like we talked about earlier, non-competes encourage them to invest in their workers. You know, if doctors can just get up and leave, why would I pay for their ongoing medical training? Why would I pay for the advertising and marketing needed to build their practice? And it basically, though, it just comes down to costs. So hospitals are still dealing with higher labor costs. They started surging over COVID when there was an incredible competition for workers, and they've stayed pretty high. Hospitals are spending more on workers, and then they're also having trouble filling open slots, right? We have a physician shortage in the United States, and so there's high competition for workers. And then they're dealing with these labor issues at the same time as they're dealing with a lot of other cost pressures, right? There's inflation, there's higher operational costs in other buckets as well, like real estate, like drug costs. They're having difficulties securing higher reimbursement from insurers. There's regulatory overhead, like a potential new minimum wage law in California, various new staffing ratios that they have to comply with. So hospitals say they're really struggling with a lot. And this is another straw on the camel's back, that they would have to likely raise wages as a result of this. It's worth noting quickly, though, that most major hospital operators emerged from the pandemic financially totally fine. So there's a real sort of sky is falling narrative among hospital associations that they're all on the brink of insolvency. And this really is not the case for major operators, right? They have very healthy investment returns. They got very generous funding during the pandemic from the government. Operationally, there are definite challenges. But net, they're in the black. So the hospitals that this really could affect are smaller regional systems, rural hospitals, the hospitals essentially that have less cash. Raising wages will be a lot more difficult for them.
Since we don't have too much more time, let's talk about the nonprofit aspect of this. And maybe future sense of like, what can we realistically expect for the next steps for this ban?
Yeah. So whether or not this applies to nonprofits is probably one of the biggest unanswered questions that we have right now in the healthcare sector. The FTC's jurisdiction is not over nonprofit entities. However, the agency is arguing that the nonprofit ban will apply to nonprofits if they are operating in a profit-seeking manner. So just because an organization has tax-exempt status, that doesn't necessarily mean that the FTC will categorize it as a nonprofit. And this is really important in healthcare because the majority of hospitals are categorized as nonprofits. It's a very small majority. It's like 58% or something, but it is a majority. So whether or not this rule applies to them is a fairly big deal. If the FTC's definition holds, if you go with the FTC's definition, this would likely apply to basically every single major US nonprofit. Nonprofits are under a lot of criticism right now for essentially acting as for-profit entities. They've been criticized for not paying out enough in community benefits to justify their tax-exempt status. They make massive investments in the stock market. They bring in a huge amount of income. They pay their CEOs multi-million-dollar salaries. They can aggressively collect debt from low-income patients. They have VC arms. They have subsidiaries that are profit-seeking. The FTC has a fairly solid argument that this non-compete rule should apply to nonprofits.
Nonprofit hospitals.
Yeah.
Are there any next steps that you're watching?
Yeah. So the lawsuits mostly. So it's pretty expected that the judge, whether in Texas or in another suit, will pause the implementation of the ban while the lawsuits wind their way through the courts. Just because the rule is challenged, that doesn't automatically pause the effective date. But it's pretty likely that a court's going to rule that implementation should be paused while the lawsuits continue. That just hasn't happened yet. If the rule does go into effect, compliance is fairly easy, though. Which is funny because, it affects tens of millions of existing non-competes. I mean, the ramifications of this, it's almost impossible to understate the ramifications of this. But for organizations to comply, they just need to notify existing workers that their non-competes will no longer be enforceable come September 4th. And companies just need to not issue new non-competes.
Sounds simple, but will it be? I guess we'll find out.
We will see.
Well, fantastic. Well, Rebecca, if anything happens in the courts on this, we'll have to have you back on the podcast. Thank you for joining me today. It was a pleasure catching up, and thanks for sharing your insights to our listeners. And speaking of our listeners, if you enjoyed this episode, please share it with the legal friend in your life. Leave a review, subscribe, all that. Thanks, and have a great day.
Thank you.
Bye.